This is National Physicians Week, and he actually is treating us to breakfast and coffee this morning. So I apologize ahead of time for that, Juan Pablo. So Dr. Idrovo is Associate Professor of Surgery in the Geitz Division. He's a native of Ecuador. He did his undergraduate training at Isaac Newton University in Quito, then medical school at the Catholic University, also in Quito. Then he came to the States and did a general surgery residency at Hofstra North Shore LIJ, and then went on to a tax fellowship at the University of Pittsburgh. So he was recruited here, luckily, in 2017. For the trainees and other junior faculty out there, if you want to understand how to set up your academic surgical career as a clinician scientist, talk to Dr. Idrovo. He's really done it right. It's very complex navigating this. You have to have the right mentors like Liz Kovacs and others, and you have to get a setup where you can appropriately partition your time. And Dr. Idrovo has just done it perfectly. His academic surgical career has really taken off. He received his KO8 about 4 years ago, submitted 2 R01s that look very promising. He's extremely sought after as a teacher and has mentored many residents, both in the research labs as well as in the clinical arena. He has already over 43 publications, has a patent, and is really, really making a difference in surgery and in surgical critical care. So with that, I welcome Dr. Idrovo up, and he's going to explain a little bit about the process. Thank you.
Good morning. Okay, initially this talk was going to be about lab findings and latest discoveries and stuff, but the last talk that I gave raised up a lot of questions from junior faculty, especially. These questions were related to surgical research career development, funding, and resources available at the University of Colorado for academic faculty. So I put this together, this set of slides to talk about each one of these topics, and I'm going to talk with an example with personal experience in my journey to becoming a surgeon scientist. So I think that any researchers or any research in general, a long-term goal is to create or be part of a dream research setup. A dream research setup is a well-oiled system capable of brainstorming, analyzing, processing, and producing information relevant to advanced science in a timely fashion. Creating a dream research setup takes several years of strategy and constant planning. Our department has several well-established labs with excellent research setups, such as the one I am discussing. I apologize for not mentioning a specific lab in this example. However, where I want to go with this is my first tip in terms of resources. If you want to pursue research, an easy way to get started is by joining one of these established labs. After learning the research dynamics, you can do your research through that lab or start your own line of research. This is not only for medical students or residents, this is actually for any faculty. In my case, during residency, I joined a well-established lab in New York. There, my mentor, Dr. Pingwan, told me to focus in 2 main goals to get started in my surgical career as a researcher as well. Number 1, to expand my collaborative network and to set up the stage for NIH funding. So how do you expand your collaborative network? Well, I attended several surgical society meetings and became part of many committees. I presented my work as much as I could, and I read papers and emailed all the authors. You will be amazed how many people will write back to answer specific questions and guide your research. How do you set up the stage for NIH funding? For this, you must know what the NIH looks for in a new PI applying for funding. They look for career trajectory, experience, or expertise in a topic, and productivity. This means NIH will more likely fund someone who publishes papers regularly and applies for funding early in their careers as early stage investigators. NIH considers an early stage investigator a PI who completed their terminal degree in the past 10 years and hasn't received a substantial funding like an R1. So for us, we have about 10 years to, from the moment that we graduate from general surgery or fellowship to apply as an early stage investigator. The next tip comes from my mentors in Pittsburgh. To grow as a surgeon scientist, you must look for an institution that supports research. This means looking for an institution that can provide protected time, initiation funding, that has NIH-funded mentors, and that can give you space to do your research. Only few institutions are fully committed to support research around the United States. Luckily, the University of Colorado Department of Surgery is one of those unique institutions. My first move when I started working here was to join the COVAX lab. Dr. Kovac's first tip was to gather data, write papers, and apply as much grants as I could, small grants, from many small surgical societies. Most surgical societies have early career investigator grants with funding ranging from 20K to 80K in average, which is enough to get started in your surgical research career. The university has several internal funding mechanisms, like the Colorado Clinical and Translational Science Institute, the CCTSI, that has several opportunities. However, the co-pilot and the K-12 programs are the most common ones relevant to new investigators. Our department also has a seed grant opportunity in a yearly basis. And other programs like the GALIP, the gastrointestinal liver immune programs, also offer funding for pilot grants in a yearly basis. To get started with data gathering, first you need an IRB for humans and an IACUC for animal studies. The PI can write an amendment to include you in an IRB or an IACUC, or you can write one from scratch. An IRB or an IACUC approval depends on the complexity of the study. For instance, if it is a simple retrospective review, the IRB approval will happen in just 1 to 2 months. The benefits of being associated with an established lab can expedite this data gathering event. In my case, Dr. Kovas included me in her projects in her IACUC, and I was able to analyze data as soon as possible. Once you gather data, it's time for grant writing. For many, this activity is brand new, but it's likely everything. The more that you write, the more that you learn. Dr. Kovac's best tip here was to get applications submitted by my peers and use them as a template. Now, you're in luck because Dr. Kovac has compiled a repository of grant applications and other documents that can help you in your grant writing. You can find them all in the Department of Surgery intranet webpage. Another tip is to have several people review your application, including senior researchers. Another thing that you have to know is that writing small grants, it takes time also. From 1 to 2 months at least, but writing more complex grants takes minimum at least 6 months. However, you have to remember that active guidance from an experienced mentor will save this time. To find mentors and collaborators for specific research topics, these are my tips. You can Google as simple as University of Colorado and your research topic, and you can find several PIs involved in the research topic that you are looking for. Additionally, there is a great resource, a webpage called Grantum. This place shows all the research grants that the NIH gives to PIs and institutions. If you filter the search by University of Colorado, you can see all the NIH-funded projects and the PIs working on them. Once you have identified the person or the group of persons that you are interested in working with, just send them an email. For an early stage investigator, there are two advisable options for apply for NIH grants, a K path or an R01 path. Both have advantages and disadvantages, but I'll just talk about these, mention some few characteristics. The K supports career development of researchers. Its main goal is for you to acquire the skills and knowledge necessary for research independence. Its requirements are 2 mentors and 3 letters of support. You need 75% of protected time to do your project. You need to enroll in educational modules and complete them yearly. And because of this setup, you cannot apply for additional NIH funding. However, on the other hand, R01s provide financial support for new independent research projects. Its main goal is to facilitate establishing your lab, develop research, and lay the foundation for a long-term career. In these, no mentors are required. However, collaborators are recommended. You need to report a little less dedicated time, about 50%. You do not need to sign up for educational modules, but because of this setup, you can potentially apply for additional funding in the NIH. And the simplistic way someone can decide about these funding mechanisms is to raise the question, do you have enough experience backed up by publications in a specific topic you want to apply for that grant support? If yes, then you can go for the R1, if not for the K. The NIH accepts applications for Ks and R01s in the months of February, June, and October. In my case, I decided to go through the K pathway. I applied in October, and I received my scores in February, and not until September is when I got a notice of award. So yes, determining if you get funded takes about a year. However, in 6 months, with this score, you can predict the likelihood of getting grant or not. The K and R01 awards for early stage investigators more commonly cover 5 years. Both require annual progress reports to demonstrate your productivity and secure yearly grant renewal. However, not to discourage anybody, but getting money for research is just the tip of the iceberg. Running a lab is hard for doctors. After all, this is not commonly taught in medical schools. However, time management is key to success. You must set short and long-term goals, prioritize and delegate as much as you can. This will help you in the balance of clinical and research work. Working with multidisciplinary teams helps share the work and generate new ideas, boosting productivity. The university has different multidisciplinary teams called core facilities that can help you with research and boost your productivity. You can find these core facilities by visiting the webpage in the university about each one of them. Now, I'll give you an example on how our lab utilizes as many resources as possible to conduct our research. First, our lab identified that the liver of mice is severely affected after burns. Our lab, using transcriptomics, metabolomics, biostatistic core facilities, in addition to our collaborative network of researchers, the COVAX lab, the Victor lab, Young lab, Lamb lab, among others, we were able to publicly name this entity burn-induced liver damage, or BILD, which established the foundation for future research. With the help of the pathology core, we identified that the mitochondria might be involved in the process of burn-induced liver damage. Later, using the electron microscopy core, we were able to confirm that, in fact, the mitochondria exhibit drastic changes in the pathology. At this point, my knowledge of mitochondria was very limited. So I needed to find an expert in mitochondria physiology. I did what I told you before. I Googled mitochondria in the University of Colorado and showed me a lot of researchers that were working in this topic. I sent several emails with my hypothesis asking for help and guidance, and several PAs responded with ideas and suggestions. Long story short, Dr. Rincon told me about this novel mitochondrial protein that she has been working previously and that may be helpful for our research. This protein is called methylation control J protein, MCJ, which is an endogenous inhibitor of complex 1 in the electron transport chain. Different papers report that by silencing this protein, they have been able to attenuate non-alcoholic fatty liver disease, liver injury caused by cholestasis and acetaminophen. Dr. Chauhan in our lab silenced MCJ in vitro using AML12 cells, which are immortal hepatocytes. He then treated the cells with serum from burn-injured mice, and he found that the serum from burn-injured mice caused severe mitochondrial dysfunction. However, silencing MCJ preserved the mitochondrial function by seahorse. Also, he showed that serum from burn mice causes the increase of reactive oxygen species and oxidative stress in AML12 cells. And silencing MCJ will decrease the amount of oxidative stress as shown in this immunofluorescence slide. Next, Andrea Coleman and Kenneth Mesa treated burn mice with a compound called GalNAc siMCJ. This compound delivers siRNA against MCJ exclusively and uniquely to the hepatocytes to silence this protein. 48 hours post-burn, the livers show remarkable improvements. The treatment even improved survival rates in burn mice, especially in aged mice. So to have this impact on survival rate, we hope that fixing the liver must fix also other organs. We currently look at the heart and the kidney, but our preliminary data is already showing that fixing the liver with this drug ameliorates heart and kidney damage induced by burns as well. With this data, our lab is one of the forefront of demonstrating the significance of liver-directed therapy in stress conditions such as burns. And I have one more experience to share. As surgeons, many of us have ideas to improve procedures. I designed some prototypes in my garage with some Home Depot tools, but I'm not a bioengineer or I don't have a degree in learning medical device development. So I searched online for bioengineers and resources in the University of Colorado who could help me through this process. Here I want to highlight 3 amazing resources that the University of Colorado has. The capstone program from the Department of Bioengineering. This program takes in a yearly basis idea from medical device development. They deliver a preliminary prototype at the end of the cycle as part of the educational process. The CU Innovations is a division of the University of Colorado that acts as a hub, unifying industry partners, entrepreneurs, and investors to advance biomedical technology. They have been instrumental in helping me patent medical devices and inventions. The Spark Rich program, this program is specialized in support the development of new healthcare technologies by providing funding, expertise, and resources. You can apply every year, which they have NIH panelists. Then you will get a pitch like Shark Tank. If you enter these programs, you will get about $200K for teaching and guidance in 2 years. All of these resources have been instrumental in my medical device development program. Thanks to them, I have secured 3 patents and developed 3 medical devices. So to summarize, achieving a dream research setup requires a strategy, planning, and the right environment. Early career researchers should build networks and seek NIH funding as soon as possible to advance their careers. Joining labs facilitate gaining experience and resources. Mentorship is key to securing funding and advancing research projects. Lastly, collaborative work and strategic use of resources boost productivity. And I want to thank everybody that I mentioned here, Dr. McIntyre, Dr. Schulich, for all the support in this, Dr. Kovacs, Dr. Chahan, and everybody in the left stage.
All right. Thank you very much. That was well presented. And, you know, there's a reason why this Department of Surgery now ranks number 13 out of 140 academic departments in the country for NIH funding. And that's because we value surgeon scientists and we support our research programs. So you presented kind of the correct pathway for getting to where you are. What are some of the pitfalls that young surgeon scientists should avoid in terms of being a successful scientist?
Common pitfalls are wandering around, not trying to go to sources like or knowing resources like the labs, the well-established labs that there are around, because that shortens really the application to getting funded. I was trying to make a point saying that the earlier that you apply to NIH funding, the faster that you are going to get into the process and learn the process. So I think a common pitfall is to think that grant writing is a foreign thing, you know, you need a lot of time to get into it. So the get to it, the fastest there is the better. So don't underestimate yourself. You're in already an incredible institution, and use all the resources and go and apply.
Dr. Naylor?
Hey, a great talk. So, you know, we have an alumni coming to give a talk about a similar sort of thing, what they've done in their career since graduating and starting that process. You know, I think it would be great if we somehow linked up our alumni that are doing translational science with people here, as well as with each other. And also, you know, some of our trainees who are coming out of the lab that want to have a career as a surgeon scientist. You know, it's not everyone, but there's usually a couple each year who are like, I really like this. This is what I want to do. But then they run into all the things that you were talking about, and how do they make it happen once they're done with their training, et cetera.
The comment was about how do we better set up a network of our past trainees and people affiliated with CU. Have you used this network?
I have not. I think that stimulating all residents, not only in the clinical world, but you know, in the research world, just keep them hooked in the research world as well. And then most of the time they come back with these network connections through emailing and collaboration afterwards and stuff. But I haven't used it.
All right. Well done. Thank you very much. So I want everyone to hold on a sec. Our president and CEO of UCH here, Dr. Tom Grono, and he has generously provided us with breakfast this morning because it's National Physicians Week. And, you know, as all of you know, this Department of Surgery would not exist if it weren't for his support and support from UCH. And that not only includes the clinical programs, but they are huge supporters of our research and education programs. Tom, thank you.
Thanks, Dr. Schulich. Good morning, everyone. First of all, happy Doctors Week. Actually, Doctors Day is this Saturday, March 30th. And so as a small token of our appreciation breakfast for everyone this morning, which hopefully was enjoyable. I want to take just a couple of minutes to say, first of all, thank you, because it is a mutual relationship, and without you, we do not exist as a hospital and as an organization. I think we have a lot of exciting things on the forefront, particularly with the next 3 to 5 years of continuing to work towards becoming a nationally recognized top decile academic medical center. That is our aspiration, and that is totally achievable with the resources that we have, the team that is constructed here. And I can tell you, among my peers, when I talk about what we have here and what we're doing, there's a bit of jealousy in terms of where we're heading and the ability for us to actually get there. So you all should be very proud of being a part of that and being part of this journey together. We're at the forefront of, I think, some significant changes as we work towards finalizing our next dean over the next month and have our final candidates here over the next 3 to 4 weeks. So very much looking forward to continuing the relationship, strengthening the partnership. But I think, as Dr. Idrovo pointed out, a lot of resources that are wonderful on this campus that are often underutilized, under-resourced. Our goal is to pull all that together to really ensure that we're strengthening all 3 missions of the organization. And the next phase of this journey is not easy, because it's tackling the hard stuff, which is variation. It's all the components that we see other academics that are doing well and ranked in the top decile do exceptionally well in. And that's where we're heading next. And that's where we need to go next. So very much looking forward to partnering in this journey. Thank you for giving me a few minutes to say my note of thanks and gratitude for all that you do, and happy Doctors' Day. Thank you all.